Hi everyone, my name is Ashley Kearse and I have been a nurse for just under 4 years now, and I work in a progressive care unit at Advent Health Orlando. It's one of the largest campuses in the Advent Health system, and I've learned a lot over these last few years. It's a great profession. I'm so glad I chose to do it. And so for my portfolio presentation, I chose to go ahead and do a digital format this time. I've actually never done that before. I've always done a hard copy resume with any other certifications that I might need to, of course, go in for an interview and have that face-to-face contact, which I still feel is very important. It's just I wanted to try this new format since I've never done it before, and I also think it is important nowadays that prospective employers have that ease of just accessing a digital file and still kind of with a video have that personal connection. So nothing beats the old face-to-face contact with the hard copies, but I just wanted to give this a try, so I hope you all enjoy it. So the first part of my portfolio, of course, is my resume, and this goes over my objective, which is to obtain a position in a supportive teaching environment where I can utilize my clinical skills and further my management and leadership skills to provide the utmost highest quality of patient care. And of course, as I said before, I do work here at Advent Health Orlando, so I go ahead and list my clinical experience, which of course is in descending order from my current position on the surgical progressive care unit, and then it goes to list my other clinical experiences that I did through my clinical rotations in nursing school. After that is my professional profile, and that of course lists my professional job duties that I carry out now as an assistant nurse manager on my unit. And then, of course, prior to that is my one and only previous job, and that was as an administrative assistant and front office supervisor with an oral surgery group. Prior to becoming a nurse, I worked for that oral surgery group for about 18 years, so it was a very long time, and I managed the front office schedule there for 2 of the surgeons, and then also about 6 front office staff members. So we coordinated the surgery schedule for the surgeons in the office, and we also had some surgeries that were done in the hospital that were, of course, more complex and required an overnight stay. So fun fact, the unit that I actually work on, my previous employer's patients, after they've had corrective jaw surgery, which is also called orthognathic surgery, come to my unit for about a 24-hour recovery period after they left the recovery room. And so I still get to see the same doctors I worked for so many years. So it's kind of like I've come full circle. So I feel like that's pretty neat, and it still, when I first started here, gave me that familiar face to kind of, feel more comfortable and kind of immerse myself in the role of nursing. So after that, of course, I go to list my activities and skills that I've obtained over the last few years and any certifications that I have. And then, of course, I go into my work history, which, as I just mentioned, is my previous employer at the oral surgery office. And then after that, I list my education, which is an associate in arts degree and ASN from Valencia College, and my soon-to-be BSN from Polk State. After my resume, I go ahead and list the Institute for Healthcare Improvement certificates that we obtained this semester. The first one being QI 101, Introduction to Healthcare Improvement, QI 102, How to Improve with the Model for Improvement, QI 103, Testing and Measuring Changes with PDSA Cycles, QI 104, Interpreting Data, Run Charts, Control Charts, and Other Measurement Tools, and the final one being QI 105, Leading Quality Improvement. And that leads me into discussing a little bit about my PDSA project. I completed that project on my shadow unit, and the shadow unit where I participated in this is on a surgical progressive care unit with 40 beds. The previous nurse to patient ratio was 4:1, and they had anywhere from 2 to 3 techs depending on the census to help out with patient care and ADLs. So about 10 months ago, this unit went into a pilot program for care team assistants. So the patient care techs went away and the care team assistants came on. They're called CTAs for short. So what they can do is they can do everything a patient care tech can do, the ADLs, bathing, vital signs, drawing lab work, taking blood sugars, helping ambulate patients, anything that a patient care tech can do, including chart for the nurse. And we all know how much of a burden charting can be. We're very concerned with taking care of our patients throughout the day, giving them that quality time, making sure that we're advocating for them. But then, of course, the charting is always there, kind of hovering over us throughout the shift. And, depending on how your day goes and how your shift is or how busy your unit is, you may not get to that charting until the very end. So that's always been an issue that nurses have to kind of work around. So this pilot was started to kind of take that burden off of the nurse, give them more face time with the patient, and just have that care team assistant one-on-one with a nurse for that whole entire shift. So there was no searching for a patient care tech. There was no, trying to find someone to help you with your patient. You have that team member with you all day long to care for your team of patients. Now, a little bit of a downside to this was their patient to nurse ratio did have to increase for this pilot to take place. So they went to 5-to-1. So now each nurse has 5-patient team along with their care team assistant right next to them all day long. They've had to work through some challenges, of course, throughout this pilot program, as with any new system where change takes place, as we've kind of learned through our PDSA cycles. So they've pretty much got it down pat now, but there's still little kinks they're working out with staffing issues and whatnot. But for the most part, I thought this would be a good idea to kind of build onto that pilot program. So the nurses were typically giving report at the nurses station, and we all know how busy a nurses station is. There's phone calls coming in, family members coming up to ask questions, other members of the healthcare team, coming in and out. And then, of course, you're at the end of your shift. You're giving handoff report to a colleague, someone you may be friendly with, and you may be just venting about your day, complaining about something that happened. Telling, them just kind of every little thing that happened during the day. And you can get into those side conversations, talking about your personal life or what you're going to do after work. And the focus really gets away from the actual report of the patient and just focusing on those important things that need to be handed off. And so that report for about 5 patients was taking anywhere on average from 45 to 60 minutes. This, of course, secondarily was affecting the end of shift overtime. But most importantly, it was affecting nurse satisfaction, and nurses were getting really frustrated with how long it was taking to give report. Again, also another factor was that sometimes you have to give report to more than one nurse, and on a very rare occasion, that could be anywhere from 4 to 5 nurses, so that also impacted the time it took to give report. So my project was to implement bedside report, and what we did for the first cycle is we just had 2 day shift nurses and 2 night shift nurses that were going to be paired up to give handoff report at the bedside. So what we did was we didn't have any particular expectation, but they just went into order of the room number. So say they were assigned rooms 1 through 5, they would just start with room 1 and then go give report and then just go consecutively down the line till they got to room 5. When we timed them going into the room and then when they came out, the average time was about 8 minutes, and so the overall time for 5 patients could take 40 minutes. The nurses during this first cycle did not perceive any difference in time, but the total time took about 5 minutes less than it was giving at the nurses station. So while the nurses didn't perceive the time change, they did say that the quality of report was better. It allowed them to focus on just what was pertinent information for that patient. The information was handed off quicker, and they had time to validate tubes, lines, drains, and of course IV sites at that moment too. The other thing that kind of complicated matters and took a little bit longer was that some of these patients are very sick. They may have multiple tubes and drains, and so it was the complexity of the patients that were kind of figuring into the time it gave to give report at the bedside as well. So for the second cycle, we went ahead and switched up a little bit. Providing all patients were stable, we went ahead and have them give report according to the least complex patient, and then building up to that most complex patient to try to buy the nurses some time back in going over, of course, the healthcare information for that patient, validating all of the tubes, lines, and drains that may apply, because some of these patients, have multiple of each. This actually reduced the report time a little further, and we had also incorporated 2 more nurses, 1 additional day shift nurse and 1 additional night shift nurse. So at that point, it reduced the report time to about 7 minutes each, and then this actually started to kind of show a difference in the end of shift overtime too. And throughout both cycles, the nurses did report that the quality of the bedside report was much better than the information they were getting when they were giving it at the nurses station. So this is something that's really exciting. The nurses were actually very engaged. So again, during that first cycle, they didn't feel that it made much of a difference except for in the quality of the report. The second cycle, they started to see that little bit of a difference, and they were getting out more on time, which also secondarily made the nurse manager happy. So it seems to be going well for that unit, and I'm kind of excited because that nurse manager would like to make this a permanent change on their unit. We're going to, of course, they're going to incorporate some more participants and just, see how this kind of grows along with that CTA pilot that they're still participating in. So I'm really excited about that. It was my first time ever being in a PDSA cycle and implementing the change myself. You know, we talked about it a little bit in nursing school, but as I reflect back on this semester, I found, of course, that this was a pretty challenging semester for me. I mean, it was a lot of information. I'm not really big on research and doing these cycles. I found some of the information a little bit confusing at first and a little overwhelming, but of course, I wanted to be able to, rise to the challenge and be able to complete this assignment, and it's actually working out pretty positively because this may be a permanent change on their unit and better the satisfaction of the nurses and, even reduce some of their end of shift overtime, which is better for the unit as a whole. So I think back and I'm really glad that we got through this semester. I mean, we're near the end here and it's really exciting, and I just hope that we can all go on to succeed to bigger and better things, and then we can just make definite better changes for our profession as a whole. Thank you so much, everyone.